So the purpose of this video is to go over the paperwork that you'll see during the IV sedation course and that you'll be using when doing sedations in your own office. These documents are found in the IV sedation course booklet and have been also found in other docs oral conscious sedation paperwork forms in the manuals given out at the courses. These forms are started to be filled out during the IV sedation consult. So if someone calls and they are interested in IV sedation for their dental work, when they come to our office, an assistant will start the paperwork process, fill out this top portion that has basically demographics about the patient on this top form. And we go over medications, their last medical visit, if they smoke, and then what their BMI and top dose is. In a second, we'll go over how to calculate that. You should probably remember how to do that, but as you can see, this patient is 210 pounds. We only put 200 pounds in the top dose because remember, we never go over 200 pounds. If the patient is 400 pounds, 200 pounds would be their top dose, and how we calculate how many tablets of triazolam they could get in a sedation visit. Now, during the sedation, this portion of the form helps keep our patient safe. In dentistry in general and in the world that we live in that's full of litigation, this part of the paperwork helps keep our patients safe. It helps make sure that we are administering the medication in time intervals that are appropriate and that we have been taught. So here you can tell that we started the sedation process as far as the oral part an hour before the actual IV was started. So we gave 3 doses of triazolam, each 30 minutes apart, and that has been documented. And then we started in on our IV sedation once our IV was placed, and I'll show you the second part of this form in just a moment. The Versed was given at a 1 milligram test dose at 12:48 p.m. And then when the anesthetic was delivered, a little uncomfortable, so we dosed at 2 milligrams. And then again, the second carpal of anesthetic given, patient's still a little more alert, so we gave another dose of 2 milligrams. You can see that each interval was given 3 minutes apart, which is correct dosing intervals. It should not be given any earlier than 3 minutes. So then during the procedure, 2 carpules of anesthetic was given. The patient had gone to the bathroom prior to entering the operatory, and the general procedure was a resident on number 19. Here, at the end of the sedation visit, the pulse ox was printed, all the patient's property was returned to them, and the patient was tolerated the treatment well, was ambulatory and oriented by 3 when they left. Name, date, and where the patient is are good questions to ask before they leave. And then the providing doctor would sign off on the paperwork, and the assistant that was in the room would sign off there. This top portion of the paper is filled out before the patient arrives, so we would know airway and that everything moved like it did, or if they were in a wheelchair, their legs didn't move, we would know that according to this paper. This portion down here is completed during the sedation. So the time that the IV was started, then the sedation was started. So 12:48 should line up with 12:48 on the first test dose of Versed given. The procedure started when the first dose of anesthetic was given, and the procedure started. And we have this carpal count sheet that helps make sure that anesthetic was given at appropriate intervals as well and spread out over time. In a longer appointment, you could give, several doses of local anesthetic. And if you just write down you gave 14 carpules, that could be excessive. But if you note that it was given over a 4-hour time period, then it is acceptable in the court of law.